Hey, everybody. Welcome to All About Health and Wellness, brought to you by All American Wellness Center. I want to talk to you about podcast junkies for just a moment because these young men are the ones that are making my message come across. Podcastjunkies.com. That's Junkeeze. Get in touch with Christian Perillo or Ben Castro. These fine young men are doing an awesome job of helping me get my message across, and they'll be able to help you as well. The reason I'm standing today and not behind the desk is I thought you might want to see what it's like to get a chiropractic adjustment with an instrument, what it's like to use a laser, a cold laser, and what it's like to get myofascial release with a percussor. So when I came in today, I asked these two young men, hey, are either one of you dealing with neck pain? Anything bothering you? And of course, Ben said, yeah, as a matter of fact, I was working out today and I did something and I tweaked my neck and it's bothering me. So I'm going to show you a little bit about applied kinesiology. There are many ways that chiropractors determine what they need to adjust to reduce a subluxation. Remember, a subluxation is what chiropractors treat. It's one of the 33 bones found in the spine that either is not rotating the way it should, bending to the side the way it should, bending forward and bending backward. And in case you haven't picked up on it yet, these are all the positions you move into. So all the bones in your spine, those 33 bones, need to move that way. And they move over these cartilage pads called discs. So these are the things that we adjust every day, like dentists treat cavities, chiropractors treat subluxation. And there's a number of different ways that each and every chiropractor works. Most of them do it by hand. It's a manual adjustment where you individually move that bone into the position where you see it's not moving normally, and then quickly a a high amplitude, low volume thrust is applied to the vertebrae to free it from whatever is causing its restriction. This is where you get that popping or cracking sound, as they say. It's actually gas escaping from the joint, so pardon the expression, it's a spinal fart. And that's all you're hearing. Nothing is tearing, nothing's ripping. But sometimes when people have ligamental injuries, as is so common when you have an automobile trauma, the ligaments get damaged, you probably are going to be better off reducing the subluxation using an instrument that's consistently reproducible, uh, fires no more than 8 pounds of pressure, and is able to reduce the vertebral subluxation or replace that swollen disc back to its normal anatomical position comfortably. So let's just do a couple of things that you could expect to see when you go to a chiropractor's office. Let's fire in on producer extraordinaire, Ben Castro.
Hello everyone. Thank you for having me.
So here's a couple of ways that chiropractors will treat a person. Number one, they'll use their hands to palpate, to feel the bones and feel how they're moving. And right there, that little tender in there?
Yeah, it is. Yeah.
Okay, so, after you're doing this over and over and over, in chiropractic school, we have to go to school for 5,000 hours. So there is a lot of time that you're feeling things over and over and over again. Now, the specialty of applied kinesiology. So what we're going to do, we're going to take this deltoid muscle here and see if it functions normally. When I press down on it, you resist me. And as I press, Ben resists me, and that's normal function. Now we're going to touch an area that may not be moving normally. And Ben, I want you to resist me. And right away, that normal function is lost as we're calling attention to that area, and the brain understands it, and it becomes very focused on that one area, and that normal function of nerve flow is interrupted. So it's another tool we use as chiropractors. It's an added tool that I feel gives us a better insight to working with the nervous system. And now I know exactly what my focus needs to be centered on. And so I'm going to use this instrument. This is an adjustment gun. And this adjustment gun fires a thrust that's 8 pounds, totally reproducible. So this gun never gets tired. This gun never has an off day or a sick day. It constantly provides that low amplitude thrust that we need to provide. And when it does its job properly, we get rid of our subluxations. Ben, is there a reason why you're wearing this hat? Can you get by without it? Okay, this man has beautiful hair. So what we're going to do is we're going to put him in a slight flexion. I'm going to gently put my hand on his forehead. I'm, I'm going to let him see what it's like. I'm just slowly pushing that trigger so it's giving him a little pressure. And then we're going to start to put Ben through different range of motion. So we bring him into extension, and we turn him this way, and we turn him that way. We go back into the middle, and we bring the head into lateral flexion, and lateral flexion, and this is the simple aspect that we do. Now, when I'm with patients, I tell them, pay attention to how the instrument sounds. When it's receiving resistance, it's a dull kind of sound. As it frees up that subluxation, it starts to rattle because it's no longer getting resistance from the bone that it's on. Can you hear that sound has changed? Yeah. And this is what helps us really understand when it's time to stop providing that kind of therapy. Hear that rattling sound? Now we're moving freely in all the positions we need to move in. Lateral flexion, extension, flexion forward. And this is what an adjustment looks like. Also, I notice right here, the bone that forms the back of the head, the occiput, is also not in proper position. So what we're going to do is we're going to take our instrument and just slowly put a little pressure here, directed specifically. And you can hear how, once again, we're getting that rattling sound. That bone moved right back into its normal position without any issue whatsoever. Now, what we typically do to follow that up, because a lot of times patients have problems that they've been dealing with for a little bit longer than just that one day. They come in, they've had these problems for a while, and they have inflammation. So this is where we use the laser. And if you take a look at it, you can see that it's sending out a light, and that light is basically firing off at a particular frequency, and it's designed to take care of inflammation and pain. So all I want you to do is just slowly move your head, bring it forward and bring it backwards. And all we do is we just shine this light on this area. All of the healing aspects of the light are going through the tissue, hitting the mitochondria of every cell that the light is bathing in its healing therapies. And the mitochondria of the cell is becoming stronger and stronger, so that function is becoming better and better. That's muscle function, tendon function, ligament function, joint function. All of those aspects are normalized by using the class 3 laser. At that point, and it doesn't take very long, it takes maybe 60 to 90 seconds of using that. And many times we also need to address what we call myofascial issues. Myofascial means the muscle, myo. Fascia is that specialized tissue that's found underneath the muscle. Let me give you guys a good example. If you've ever cooked chicken thighs, and when you're cooking the chicken thighs after you're done, you look under the skin and you see this film. It kind of looks almost like saran wrap. It's silvery. That's fascia. Fascia is found in all living creatures, and it is a communication system of specialized tissues, and many times it can get adhered to the muscle. So to free that, we use a percussor. The percussor is just wonderful. It feels like a very quick vibrator, and as we're using it on the tissue, we're kind of doing diagnosis and treatment at the same time. If you've ever had the unfortunate experience of ironing, when you hit a problem of fascial adherence, that that percussor sticks right there. Can you feel how that's
Mm-hmm.
sticking? Yeah, and just like when you're ironing and you hit a wrinkle in the fabric, you just keep going over and over again till the iron no longer meets resistance. You're getting rid of those wrinkles and those adhesions in the fascia. This is called myofascial release. And again, just like with chiropractic adjusting, there's a number of different ways you can release the fascia. This just happens to be the most fun and most comfortable. So, as you can see, we work all of the related musculature that moves the neck and supports the neck. And as we run up and down with this percussor and we see it's moving nice and smoothly, we're done. You know, you're not investing years of time when you come to the chiropractor. Many of us do what we call a maintenance care for our patients, where maybe they're having a little pain, this and that, and these are the people who come in to see us once a week. They're in and out of the office within about 5 minutes.
Wow.
During that time, we ask them pointed questions. How's your energy? How's your digestion? How are your moods? How are you sleeping? You know, all of these things give us insight to whether the person's functioning at 100% optimum health or they're not. And now we'll go ahead and just recheck this. We'll use that deltoid muscle, which is functioning well, and we'll just touch all these areas on the cervical spine and the occiput. And as we can see, every time I touch these areas, I'm stressing that muscle to see if it shows me any other areas. Oh, okay. We didn't work on the cervical, I should say, we didn't work on the thoracic spine at this point. Where I was just demonstrating cervical subluxations, but we found a thoracic subluxation
Um,
or a subluxation in the mid back here, which we'll take care of when Ben is no longer on camera and I am free to give him my attention. So I want to thank you very much for joining me today, Ben.
Thank you so
Any
much.
questions of what we just did?
No, I mean, I definitely feel a difference. My neck isn't as stiff as it was when I first, was in here. So I thank you very much for that.
Well, it's my pleasure, certainly. And again, this is what instrument adjusting is all about. Many times people see some really radical adjustment therapies that are on Facebook, and a lot of times they do these to get likes and to get people to pay attention. So the more startling your presentation, the more likes you end up getting. But in reality, it's not painful to have a subluxation reduced. It doesn't hurt, and it can be done in a relatively short period of time. So if you really want to function normally, remember these spinal units, these 33 bones, have to allow normal movement, or where the central nervous system and the peripheral nervous system meet can be pinched. The peripheral nervous system means away from the midline. So we have pinched nerves. It can affect how our shoulders function when it's affecting the cervical spine. It's how our hands feel. It's the things that we do every day without even thinking about it. But once we start having pain or dysfunction, it can be a real bothersome issue. And this was specifically tailored to tell you about cervical dysfunction, but it can happen in the mid back. And sometimes when people have these subluxations, like we picked up on Ben, but didn't address, it can cause pain to be noticed in the front area, or it can affect how the lungs function, and we can get congestion and wheezing. These are simple things that are not necessarily full blown infections, but areas where the body doesn't function at 100% normal. So Once again, I want to thank you for joining me, and I want to thank you, Ben, for being kind enough to be my volunteer.
Anytime. I loved it.
And ladies and gentlemen, I thank you very much for joining me today. This is Dr. Usry from All American Wellness. Again, we are located in Lake Park, which is south of North Palm, just north of West Palm. You can come in for a free 15-minute evaluation, and we'll determine whether you're functioning at peak efficiency from a biomechanical standpoint. Are all your joints moving normally? We also check out your biochemistry. Are all of your areas that need to be addressed with nutrition being met? And we look at your bioenergetic function because we do acupuncture in the office, so we're looking at energy, mechanics, and chemistry. Thanks for joining us. Again, don't forget we're here once a week. This is all about health and wellness. We're on YouTube, we're on Spotify, we're on Apple, and we're really looking forward to have you join us every week. We're always talking about different topics. Of course, we specialize in automobile trauma, so a lot of times we're presenting a lot of our focus on those kind of injuries that happen as a result of an automobile trauma. But we work with all sorts of things like dysfunctions in our digestion, problems with fatigue and energy that just doesn't seem to be where it needs to be. Could energy and sleep have something to do with one another? Absolutely. And I know what you're saying. Yes, of course, if the Krebs cycle is affected, you're going to have problems with your sleep and energy. You got that one right. Could we have hip pain and energy issues? Of course, I know a number of you are saying, yeah, that's iron. Right, if your iron is low, your hips are going to bother you. You're going to feel a sense of tiredness and fatigue. You're just not going to function normally, and you're going to notice pain around your hips and your knees. How about those of you who are taking yoga and you find that, oh no, I'm really stiff after yoga. I don't feel good at all. There's a reason, because yoga is very good for you. But if your fascia, remember the fascia? We talked about it when we were doing the myofascial release with the percussor. If your fascia isn't functioning, it's not stretching when your muscles stretch, it causes a lot of stiffness and discomfort. And what could be the bottom line reason why that occurs? Of course you're right. It's B12. If you're not getting B12 and it's not an active form of B12, then your fascia suffers, and when you start stressing it by stretching, it doesn't work very well and causes a lot of pain. This is why a lot of people come into our office who are having plantar fasciitis. Their fascia in their feet is inflamed and they're hurting. And if you've ever had that, you can really relate to how frustrating it is to find the right doctor to fix that. We usually fix that in 1 or 2 visits. You got to address all the things, the mechanics and the chemistry when you're dealing with this type of issue. And some patients also need acupuncture to help them, and this is what we use. So energy, chemistry, mechanics, those are the things that need to be addressed. Thanks for joining me. I'll see you next week. This is Dr. Usry saying thank you for being here, and thank you, Podcast Junkies, so that I could give my message.
Thank you.
I'll see you next week.
Great.